Welcome to another edition of Real Men Wear Gowns. This is our year-long series to encourage guys to get that scan, get that checkup, take our health seriously. And today we're digging into a condition that affects nearly 1 in 5 Americans. GERD, short for Gastroesophageal Reflux Disease. You may know it better as chronic acid reflux. And if it's left untreated, GERD can lead to serious complications. Dr. Paul Haynes from Indianapolis Gastroenterology and Hepatology is here to tell us what we need to know. Thank you very much for being here.
Thank you, Dustin, for having us.
So that burning sensation in our chest, especially after meals, maybe when we're lying down, what is that and how does it happen?
Yeah, we call that acid reflux. People experience heartburn, kind of a burning sensation in the chest. Sometimes they get a little bit of regurgitation or food contents or sourness coming up into their mouth, back of their throat. They can get a sense of nausea, a sense of chest discomfort, typically a burning discomfort. It happens when food contents, typically acid, comes up from the stomach into the esophagus.
And there are over-the-counter medications we can take for this, but how do you know when it might be time to see a doctor about it?
Right. Typically, we talk about when patients are having symptoms more than 2 or 3 times a week, when they're starting to interfere with their quality of life, when they feel like it's impeding things that they typically would enjoy, impeding meals, impeding their ability to, stay focused at work, keeping them up at night, interfering with sleep.
This is something that I've suffered from occasionally, and it can be absolutely terrible pain. I mean, are there varying degrees of acid reflux, or is it always way up there?
There are varying degrees. Most patients have similar symptoms. The severity is really hard to determine based on symptoms alone.
Okay.
But in terms of the frequency, the intensity, it can vary with patients.
What are the treatment options once I see you as a gastroenterologist?
Yeah, typically when someone comes to my office, they've already tried a variety of over-the-counter therapies. There's calcium, carbonates, there's alginates, Tums, Rolaids, Gaviscon. Over-the-counter options even include H2 blockers like Pepcid or famotidine, and the more advanced, the more aggressive therapies are over the counter now. Generally, because they're so safe, they're now allowed to be sold over the counter. That includes, omeprazole, Prilosec, Nexium, Prevacid. Those are all available. So typically, when they come into our office, they've already been on a variety of medications. They don't really feel like they're getting sustained and sufficient relief. And
so that would be a prescription that you would take just regularly, not necessarily only when you get the acid reflux?
Yeah, if you're only having symptoms periodically, then you really should just be taking something as needed, right? You really don't need something every day. The most effective, on-demand or as-needed medications are the H2 blockers like Pepcid or famotidine. They work effectively, a little more effective than the Rolaids, the Tums.
Okay. Basic question here. Is there a technical difference between acid reflux and GERD, or is it basically the same thing?
Yeah, acid reflux is what we all experience. Every one of us has experienced acid reflux. It's typically when you have a large meal, when you're having some alcohol, when you're eating late at night, carbonated beverages. Each and every one of us has generally had an experience of acid reflux. When it becomes a long-standing, frequent problem that's interfering with your quality of life, or you could develop complications, then we classify that as GERD.
Okay, and what are those complications?
So complications, can be swallowing trouble. Over time, that inflammation can lead to inflammatory stricturing or narrowing of the esophagus, and then patients feel like food's getting stuck or held up when they're eating. They can develop bleeding. Sometimes these patients have blood in their stool, dark black tarry stools. Rarely they can vomit blood. They can develop anemia from blood loss that happens over time. They can start having abdominal pain. And then in more serious cases, they can develop what's called Barrett's esophagus, or a precancerous condition of the esophagus, and finally esophageal cancer.
Wow, so this really is something that you should pay close attention to if this is happening more and more.
Yeah, especially if you've had it for a long period of time and you're an older patient that's had it for 5 years or more. It's really time to start talking to your doctor about this condition.
What can we do to prevent this?
Well, so number one, not smoking, keeping your weight down, staying active, and then there's some dietary measures we can all take in terms of not eating late at night, limiting alcohol, carbonated beverages.
Okay. What about eating quickly? Is that a myth that the faster one eats, the more likely they are to have acid reflux?
Well, there's a little bit of truth to that. So when we eat, our stomach should relax. We call that accommodation. So the stomach should relax in preparation and in receiving the meal. If we eat quickly, you just kind of gobble down that cheeseburger, the stomach hasn't really had time to accommodate, and so that can lead to some more troubles with acid reflux.
Okay. What's your final message to viewers who are watching who may be hesitant to go to see you if they're developing these symptoms and experiencing them pretty regularly?
Yeah, I mean, I think this condition is more common in men than women. It's more common in older patients than younger patients. And if you're starting to develop what we call alarm symptoms, it's really time to start talking to your doctor. Those are symptoms of pain or difficulty with swallowing, ongoing upper abdominal pain. If you've seen blood in your stool, or if you've vomited blood, or if you're having unexplained weight loss, it's time to really have a conversation with your doctor.
Dr. Haynes, thanks so much for joining us. Really appreciate your time.
Yeah, absolutely. Thank you.
All right.